Hello, Sally Ann here at PT Skills. Today's bite-sized video is on functions of the skeleton. So as normal, grab your notebooks, your pens, bits of paper, ready to take some notes, and I shall hit share on my slides. Here we go. Okay, so skeletal functions. So we have 6 functions of the skeleton. So we have to support the body. So without the skeleton, we're just a pile of mush. So it's to give support and that shape for the body, protecting our internal organs, so specifically that rib cage, lots of organs hidden behind there, so and the skull for the brain, so protecting those internal organs. Sources of blood cell production, so the skeleton does produce those red blood cells and those white blood cells. Bone growth, muscle attachment for movement. So without the skeleton, muscles cannot attach to the bones, therefore we cannot facilitate movement. And for storage of minerals, specifically calcium, which we also know we need for obviously skeletal growth, but also for muscle contractions within the energy system. So the skeleton is broken down into 2 parts, so you will need to know this. It's axial and appendicular. So if we look at what the axial comprises of, we have the center of the skeleton. So you've got the skull, or the spine, and the rib cage. So that is your axial, so cranium, ribs, vertebrae, sternum. So that's your axial skeleton, and you will need to know that, so make a note of that. I'm sure there will be questions on that. And then your appendicular is everything that's literally attached to that. So from the collarbone to the scapula to the arms, the legs, the pelvic girdle. So everything attached to the axial is your appendicular. So make a note of that, because there will be a task at the end as per normal. And then we're looking at those functions. So we've got support. So the framework, the support, the structure, the scaffolding of the body, that's one of the functions of the skeleton. Protection, as I've also said, so we're protecting, so the skull is protecting, the rib cage is protecting all those delicate organs within our body. And then attachment points. So we know that the tendons attach the muscles onto the skeleton, so they're going to anchor so that we can create movement. So those muscles are going to cross those joints so that the tendons can attach to a skeleton and pull. So muscles are going to pull on those tendons to create that movement. So the skeleton is for those attachment points for muscles. And we produce those red and white blood cells as well. So red for transporting oxygen around the body, and we know that white blood cells fight infection. So it's super important as well that we know that our long bones specifically are going to create those blood cells. And storage of minerals, so calcium and phosphates. We know that we need calcium for muscle contraction, calcium to recreate bone as well, to build our bone. And ossification. So ossification is bone growth, fancy word for bone growth. So bones are living tissue. So you may not think they feel like that, but they are living tissue. So ossification helps our bones grow and harden. So we use osteoblasts. So blasts, I always remember blasts and clasts. So blasts are building bone. So osteoblasts build the bone and help us create additional bone. And osteoclasts clean the bone. So I think of building and cleaning. They're the cells that destroy bone and reabsorb calcium stores. Within a bone, you can see we have that epithelial plate. That's like our bone growth plate, and as we grow from that. It's also known as the growth plate. So as we grow from children, this growth plate is where we are going to grow from. So you will need to know the anatomy of the bone. So if you have a closer look at that bone, we've got the articular cartilage around the end, that blue lining. You've got the cancellous bone. You've got the epithelial plate, which is our growth plate. You've got the marrow cavity in there, the periosteum, which is the outside of the bone, and the compact bone. You will need to know the diaphysis, the shaft, the epiphysis, the ends, and the head as well. So you need to be able to label a bone, and there may be a little challenge for you to do that in a moment. So the main points from here are ossification. What is it? It's bone growth. osteoblast build, osteoclast clean, and you have the makeup of the bone here, and you will need to be able to label that bone. So your task for this quick bite-sized video is to list the 6 main functions of the skeleton. So identify those 6 functions, name the parts associated with the axial and appendicular. So what did the axial consist of and what did the appendicular skeleton consist of? Quick description of that, and to draw a long bone and to label a long bone in your notebook. So hopefully that makes sense. Love to see any of your drawings down below as per usual, and any of your notes. Have a good one, and I shall see you soon.